Hi, I'm Nick Slinkovich, Denver Body Doc, Colorado Plastic Surgery Center. This is a video of important information you need to know before you make a decision for breast implants in a breast-based surgery. You probably have questions about what is implant sizing like, silicone versus saline, textured versus smooth, under the muscle, over the muscle, what incision do we use? We'll help you sort through all of that, and I also want you to know information about preparation for surgery, what recovery looks like, and importantly, what happens? What are the risks and side effects of having an implant or an artificial device placed in my body? Top of mind is always sizing. How big am I going to be? Am I going to be too big? Nobody wants to be too big. Super personal choice. We use 3D sizing, taking your picture and simulating for you sizes. I found this to be the most helpful. I personally do that simulation, make adjustments, and explain how that would compare for you. And then we can look together to find out where that good fit would be. Vectra is phenomenal for sizing. We look at your Vectra, then we look at simulated implant sizes. I like looking from the side. It shows us the best difference. And then as we add volume, things increase in size, increase in size. We'll find implants that are well fit for you and look to find out what your best options are. We can look at this in multiple perspectives. So looking at the near side of that breast or the middle part of that breast, we can see a change in size. We can also look at comparisons. So lots of ways I can show you the information to find the best size for you. We'll definitely go through silicone versus saline. I generally use round implants, but I can explain to you if you have questions about the differences with a textured implant or differences with a shaped implant. I use very few textured implants anymore. They have some benefits. They do stay in position better, but textured implants have been associated with a very small risk of ALCL, which is a cancer basically caused by the implant. We don't see that with smooth implants. So if you have questions about a textured implant, where it may be a benefit for you, ask me because otherwise I won't go through that in consultation. These are two implants, very high profile, very low profile, and we have multiple options in between. I'm always going to fit this specifically to your body, so it's very dimensional, and we'll definitely get into that in your consultation. There are saline implants, and again, I talked about textured implants. Most of the time, we're using the smooth, round silicone gel implants. So as necessary or as you have questions, we'll go into those other options. This is a fifth or sixth generation, depending how you count it, breast implant. Gummy material on the inside, it's cohesive gel. The shell itself is made from solid silicone rubber. In the dipping of the layers of the solid silicone rubber, there's a barrier layer in there that resists any movement of the silicone from the inside of the implant to the outside. Very, very durable. I've driven over these with my truck. If you saw an old Snapchat video, you would have seen that. And they're very hard to damage. Most commonly, we're going to place the implant via an incision below the breast, adjusted for where we want the breast crease to be, raising up the pec muscle, goes from your arm to your breastbone, and placing the implant underneath it. Now the upper portion of the breast is covered by the muscle. If we have very thin tissues, this can be a big benefit in helping blend in a more natural shape up above. If we have more breast tissue, it becomes an option to go on top of the muscle. If I place the implant on top of the muscle, I actually raise the fascia of the pec muscle up and go underneath the fascia and then still on top of the muscle and underneath the breast. That has a slightly higher rate of capsular contracture. So in those cases, I will always use absorbable mesh to help us decrease that risk. Breast lift may be an option, even sometimes when you think, no, I don't need a breast lift, and I certainly don't want a breast lift. My role is really to point out how we're going to best reach your goal, and sometimes that would be with a breast lift if we're looking for a fuller, more augmented look, want to have the ability to not wear a bra, but almost look a little bit like we are anyway, t-shirt, athletic wear, that type of thing. So we'll go through that if that becomes an option for you. You may be a patient that has an option to just place an implant, but it's also an option to do a breast lift. This is one such patient. This is our 3D capture that we've taken in our Vectra system. So let's take a look at it. It's really helpful to be able to have a three-dimensional picture where I can go through and simulate for you and look at different perspectives. This is super helpful for sizing. We'll definitely do this for you. In this case, what do you think? Would you do a breast lift here? Do you think this patient would want a breast lift? The answer is it's going to come down to really what your goals are. If we're looking for a very high, slightly full look where we can not wear a bra and have an augmented look, we're going to have more of a result of that with a breast lift in this case. So let's take a look what that might look like. We've got two pictures. Over the top here is showing a lift with the implant. Below is just the implant being placed. Look at it in different perspectives. So if we turn it to the side, we can see a higher position, and if I flip them backwards, more perkiness on top. So this will vary person to person. I'll definitely do this simulation for you, show how that lift is done, and we'll get a good comparison. The important thing to recognize is if we want this lifted higher, fuller shape, sometimes by more than a centimeter or so, sometimes by as much as a half inch, that would require a lift to achieve that versus not doing a lift. Pros and cons to both. We want to find the best fit for you. Why would we use an implant when there's an option to just fat transfer the breast? It's a good question. Fat transfer to the breast is an option that can give us a half cup size, maybe 1 cup size increase, and very often we're looking for more than that. And the implant has this special ability to give us fullness and perkiness of the upper breast. In our body, it maintains its fullness and resists what our tissue tends to do, which is flow down towards the bottom of the breast. That said, fat transfer can be a great option, either with an implant to help cover or give more fullness in the cleavage or upper part of the breast, or by itself. In short, implants help us achieve our goals a huge percentage of the time. Fat transfer can be an option. If you have a desire to talk about more about fat transfer, please let me know. We'll talk about it at consultation. Implant is not a lifetime device. It's an artificially made, goes in your body. It will wear out or require reoperation at some point. One reason would be for capsular contracture. Our body heals around an implant in our body, forms a capsule around the implant. Most of the time that capsule is helpful, not harmful. It varies. It can be a little softer, where a smooth implant like this may move around more. It can be a little more supportive, where it can help stabilize the implant. We don't know ahead of time exactly where you'll be on that scale. Contracture is different. Contracture is the capsule that's around the implant tightening and squishing the implant. The breast can be firmer. It characteristically can move the implant to a higher position. It's probably the most frustrating thing we see with implants. So we want to minimize those chances. Recovery is a big, important impact that you have. So if we're getting an implant, you need to prepare to have 6 weeks of not using your upper body for anything strenuous. Very, very important in recovery. I'm taking a number of steps to minimize, from a technical standpoint, the chances of capsular contracture from surgery itself. Our practice is invested in the ASPEN system for capsular contracture. It's externally applied ultrasound to the capsule that helps us decrease and soften a capsule. We'll sometimes use that preventatively as well. The benefit being working to optimize capsule health in circumstances where it may get tighter, and that can potentially reduce the chance of having a capsular contracture or even the need for reoperation. With an implant, I'll often use absorbable mesh. I've got a couple pieces of mesh here. It dissolves over time, but it has some benefits. It's very strong. It can help resist the implant pushing too low. It leaves additional tissue behind as it absorbs. That can only be a benefit. And we feel it decreases the chances of capsular contracture. So there's multiple reasons we may recommend using mesh, and that's something we'll talk more about at your consultation. Many women ask about pregnancy with implants. In terms of timing, should I do the implant before or after pregnancy? Well, if you're thinking about trying to get pregnant in the near future, I would go ahead and wait till afterwards. Breastfeeding with an implant in place is recommended. It's healthy for your baby. Implants are unlikely to change your ability to breastfeed. So overall, if you have an implant in place, you have a pregnancy, and you want to nurse, I say yes, breastfeed. When we place an implant, we want to know the status of that implant. We also want to know if there's any change in your breast. If the breast swells up, if it becomes firmer, if you notice something within the breast, those are all things we want to check out. If you have the implant wear out, that could be silent and we may not know it. If the implant wears out, average being maybe 10% of women at 8 to 10 years have had a disruption of one of their implants, we want to be screening for that disruption or wearing out, tearing the shell of the implant. And we do that either with high resolution ultrasound or an MRI. There's guidelines for when we want to do that after surgery, but basically the minimum, I would recommend getting this evaluated at least every 5 years with an imaging study to identify the integrity of the implant. I want you to understand that there's a very small chance that your implant could actually make you sick. My experience has been that really it is exceedingly rare. I've only seen a couple instances in 20 years in my own patients, but no cases do we want someone to be made sick by their implants. Certainly, if we suspect there becomes an issue over time, we'd want to evaluate that and remove the implant if we think it's causing a problem. So in summary, coming in for consultation, I look forward to meeting you, answering your questions. Please write down and bring in additional questions you may have either from this video, but you otherwise have.